Hi everyone, my name is Mariah Flores and this is my speech on universal healthcare and why the US should implement it. So what is universal healthcare? Universal healthcare is a system that's implemented in which all people, regardless of differences, can access medical treatment and assistance without facing financial hardship. The core values of universal healthcare are equality, accessibility, and financial security. So the equality factor plays into the fact that anyone can receive equal access to the treatment that they need. The accessibility aspect plays into assurance that anyone can face the exact accessibility of the treatment in which they need to be able to fight their illness or disease that they're fighting. And the financial security assurance of universal healthcare is that people will be able to live normal lives after going through debilitating diseases and fighting them. So why the US should implement universal healthcare? The United States is one of the leading nations in the world, yet thousands of people each year go bankrupt in the US because of the simple fact that they cannot afford healthcare, especially people who get diseases and fight debilitating diseases like autoimmune diseases and things like cancer. While the US has the highest medical budget out of any first world country, many US citizens don't receive the same access as other countries in first world nations do. So the number of people who go bankrupt every year in the US is 643,000 people compared to other first world nations that have implemented universal healthcare like Britain, Japan, France, places like that, where the number for people who go bankrupt every year for medical bills is 0. Another great example of why the US should implement universal healthcare is because we're going to look at a chart as to how much the US citizen pays for certain procedures versus other places in the world that have universal healthcare, which these procedures are covered under that insurance. So a hip replacement in the United States is $29,000. While other first world nations have it at around 17. I've seen things that vary to around 19, which is still $10,000+ less than what we have to pay here. A knee replacement is $28,000, while in other countries it's $18,000. So it just goes to show that comparable countries that implement universal healthcare versus the US actually are doing financially better as far as what is being paid. So medical debt compared is something that I wanted to look at for this speech as well. According to the American Public Health Association, the US spends 4 times more per capita on administrative costs of healthcare compared to other nations, first world nations with universal healthcare. And according to the same source, the US spends more money on healthcare than any other comparable country that implements universal healthcare, yet it hardly achieves better results. So some real stories of people who are affected by the medical system in the US and not being able to afford basic luxuries after not being able to continue to live a normal life there was a study conducted by the West Health Administration, and the study found that 34 million adults know someone who died for not being able to get the proper treatment they needed to fight a disease or an illness that they acquired while in the US. And 58 million adults report the inability to pay the money for needed drugs and needed medication. And this is just in the last year. These are medications like insulin, which are actually vital, as well as things like asthma pumps. I've actually heard stories of people dying because they're not able to pay to, get their asthma pump, which asthma is one of the most treatable illnesses when you're able to actually treat it and when you have access to the medicine to treat it. So how a universal system could save money and lives. The American Public Health Association conducted a study which concluded that if a universal healthcare system were adopted, the single payer system could save around $400 billion a year while also building a better healthcare system and economy. This is because people will actually be able to live after getting these diseases. They won't have to go bankrupt, they won't go into debt. And this just builds the economy better because they're actually able to pour back into it. So with a universal system implemented, millions of people will have access to life-saving treatments and preventable treatments without having to not access the treatment or risk the possibility of death because they weren't able to receive it. So in conclusion, universal healthcare is a right that all should be afforded because it's a basic health concern and issue. By implementing universal healthcare in the United States, we can build a healthier, stronger, and more resilient society while saving lives and giving people the opportunity to access the right to treatment. And that is my speech. Thank you for listening. I hope I was able to persuade you into fighting for universal healthcare.